Good morning and good afternoon. Welcome to the Weekend Wellness Hour show. Today we have a relatively new friend of mine. We met earlier this year at a conference, a real estate conference, and we were in Belize and we touched base and hit it off a little bit, especially since we both have a health background. And so I want to welcome Dr. Jherie Ducombs, who is a cardiologist in New Orleans. She's an assistant chief medical officer in her community hospital, and she's also been the chairman of the Network Operations Council for Multi-Specialty Physician Group. So Dr. Ducombs is very much passionate in heart disease prevention. She looks at lifestyle, she looks at the whole person, and I wanted to bring her on to talk about the heart because I haven't had anyone on talk about this yet. So thank you so much for joining us today.
Thank you for having me, Amy. I'm excited to be here.
This is great. And can you tell us a little bit, I touched base on your background, but can you tell us a little bit about how you got into cardiology and why heart disease prevention is so important to you?
Yeah, absolutely. So I knew from a very young age that I wanted to be a doctor, and I wasn't quite sure exactly what path I would go down. But I'll have to say a couple of things happened during medical school. My grandpa died suddenly of a heart attack, and even outside of that, when I rotated through the cardiology service and saw the imaging echoes, which are ultrasounds of the heart, and angiograms, which are studies that show what the arteries of the heart look like. I mean, I was just so excited about the possibilities of what can be done for people to prevent heart disease and early deaths, and knowing that heart disease is the leading cause of death in the United States and many other developed countries, and that 80% of it is preventable. Just felt like there was a lot of opportunity to really make a difference in the lives of my family and friends and patients and anybody I could reach. And then in my internal medicine residency, I just really enjoyed the cardiology service, so much to learn. And like I said, so many opportunities in so many different ways to really help people.
That's wonderful. And while you started studying that, obviously there's so many things that can happen with the heart. Why did you pick heart disease prevention in terms of, instead of like a surgery route, or do you do both of those?
I do. I'm a general cardiologist. I'm an invasive, non-interventional cardiologist at this point. And so I still do procedures. And I really do enjoy that. But I'll have to say that preventing misery is number one for me. Like, if I can do that, like I said, for myself, my family, anyone else, that life's just short and we want to enjoy it. And heart disease is, like I said, it's the leading cause of death in the United States. It impacts so many people, and there's so much you can do to prevent it. It's costly, it's painful, it's deadly, and it doesn't have to be.
And when you talk about heart disease, can you give us a little bit more of a definition of it and what it all encompasses for those who aren't familiar with it?
Sure. So maybe part of the reason why it's the number one cause of death and morbidity in the United States is because it is such a broad definition. I like to, when people come to me and they don't necessarily understand the different types of heart disease, I kind of like to just explain the heart like a house, like it has its own electrical system, it has its own plumbing, the arteries, it has walls, the walls of the ventricles and the atria, it has doors, which are more like valves. And, when my patients don't understand why they need to go see a heart rhythm specialist, and not just me, I try to explain, well, I'm like your general contractor. I work on the whole house, and you need, somebody who specializes in the electrical system. So there's everything from congenital heart disease, which is not common and is becoming more and more treatable every day. So those are diseases that heart defects that people are born with. coronary artery disease or blockages in the arteries of the heart. Typically they're blockages, but they can be other things like spontaneous coronary dissections, which can affect young people that you wouldn't otherwise suspect might have heart disease. So sometimes young women, even athletes. There's valvular heart disease where the valves can be malformed either from birth or just over time, and they can be either narrow or leaky depending on what the problem is there. Heart attacks, high blood pressure also falls under the category of heart disease, and all of the sequela or the bad consequences of longstanding high blood pressure fall under that as well. Like I said, heart rhythm problems, and there are a whole host of heart rhythm problem possibilities. And then you can have infiltrative diseases of the heart muscle, and something that's been in the news lately with COVID is pericarditis, which is inflammation, myocarditis, which is inflammation of the heart muscle, but there's also pericarditis, which is inflammation of the lining around the heart. So it's a broad category of diseases.
Yeah, and I can imagine when you have this broad category and you have all these different types of issues, I can see why you need a specialist for each one of them, but also does the treatment or kind of the prevention, is it more specific on the type of issue that a person's having, or can you look at and say, if you do these things, it will help your heart overall, no matter what little specific problem you're having?
Okay, so certainly the congenital heart disease, so defects that a person is born with, we can't impact the structure of the heart, but we can make it as healthy as possible. There are some other genetic diseases or like infiltrative cardiomyopathies that we can't prevent, but the most common ones we can. And it's not just coronary artery disease or congestive heart failure, but also heart rhythm abnormalities. For example, atrial fibrillation is one of the most common heart rhythm abnormalities, and it increases in frequency with age. Increases in incidence with age. But there are some risk factors that go along with the development of atrial fibrillation that you can go a long way to preventing, like high blood pressure, by eating well, reducing your sodium intake, getting regular exercise, getting good sleep. Sleep apnea is also associated with the onset of atrial fibrillation, so important to make sure you have good sleep habits, to maintain a healthy weight, and to get tested if there's any sign that you might have sleep apnea, and to be open to the treatment. Sometimes that's a big barrier right there, is just being willing to accept that treatment. Because once most people do, they realize they can't sleep they don't get good rest without their sleep machine. So.
And I can imagine there's probably a financial barrier too for some people for the sleep apnea machines as well, unless insurance covers it.
Correct. With a good, sleep study and abnormal result, it should be covered by your insurance company.
Okay. So those are some of the biggest factors. What about genetics in terms of like atrial fibrillation or some of the other components of heart disease? So genetics, they play a big role?
Yeah, they do. They do. And it's kind of multifactorial. So some people have a very strong genetic predisposition to developing coronary artery disease. And in those patients, we're talking about men younger than 55 and women younger than 65. So if you have a strong family history of heart disease younger than that age, then you need to pay particular attention to that. Maybe start asking your family members, okay, who in the family has had what, so that you can talk to your doctor about it, or at least be aware of it. There are genetic predispositions to heart failure. So it's important to know if multiple people in your family have had heart failure, or some valve problems can be genetic. atrial fibrillation sometimes tends to run in families. So it's just really important. We might not be able to prevent those entirely, but we can maybe, if we're aware of them, and do everything we can to mitigate the effects of that, or at least catch it early and keep it under control. There's a lot we can do these days to live a good long time and have good quality of life despite having heart disease.
And I can imagine diet plays a big role in that as well.
Yeah, yeah. So when we say that 80% of heart disease is preventable, it's simple, but it's not easy. It is diet and exercise. It
Mhm.
really is.
And I imagine processed foods is a big component
Mm,
of the problem, right?
that's my trigger. That's my trigger button.
Mhm.
Yes. So yeah, processed foods are the enemy. Sugars are the enemy, and processed foods are the enemy, and certainly ultra processed foods. So a lot of people don't understand what processed foods are. So I'll just go into that for a
Yeah,
second.
that's fair.
A whole food, for example, is if I want to make a soup and I go to the store and I buy a butternut squash and I bring it home and I peel it and I cut it up and I cook it in my soup. A minimally processed food is when I go to the store and I buy a butternut squash that has already been peeled and cut up, and I just put it into my soup.
Mhm.
Love those. Those are great.
Mhm.
But as we go down um, the manufacturing process, or changing the chemicals, like if we take grain and now we're making white flour, or the more that we process a food, the more that we strip the natural nutrients from it and add things like preservatives, and um, salt is a preservative. And the salt's also there for the taste too, and the sugar for the taste, and the more that we take out the natural fibers and vitamins and minerals, and the more that we add things that you can't pronounce, basically. So
Yeah.
it has a lot of ingredients on the label. It's an ultra processed food. If it's been through a lot of chemical changes before it gets to you, that is an ultra processed food.
Mhm.
And really, obesity is an epidemic in the United States and many other places. And that really started with our convenience foods in the 1970s, didn't it? It started
Mhm.
when we started taking natural things and processing them and repackaging them and distributing them, and maybe trying to make something low fat, or low calorie. It's when we got away from the natural way
Right.
that food grew or was harvested and eaten at the table, that we started to really see the effects of that.
Yeah, and it's hard because when you live a busy life, it's very easy and tempting to grab something that's already prepackaged or made or in a box or a can. And there was that addictive quality to it too, especially if it has sugar and salt in it.
Absolutely. Absolutely. Have you seen the study about the lab rats that will prefer sugar over cocaine?
No, I've heard about it, but I haven't actually done much
Yes.
into that. Wow. That's,
Yes.
yeah.
And so when people add a lot of sugar to the foods that we eat, you're right, it's very addictive. And the, I'm not opposed to the keto diet. I
Mm.
have seen people lose a lot of weight, get really lean, look fantastic, feel fantastic. When I first heard about it, I was not for it, but I do think that it has its place. But I
Mhm.
also think that there are good carbs, and those good carbs come in natural forms, and they are associated with a lot of fiber and nutrients, right? But the processed foods, they just give us the carbs without so much fiber and the other nutrients, and that's not healthy for us at all.
Right. And with so many different diets out there, I know it's hard for people to figure out what is correct and even what is correct for themselves. And a lot of times people just give up,
Right.
just say, I'll eat whatever.
Yeah. Also, so going back to your point about um, it's not convenient to
Mhm.
eat healthy. It's not cheap either.
Mhm.
Sometimes the ultra processed food is cheaper than making a meal from scratch. And of course, it takes a lot of time, and we all have very busy lives. There is a blogger who I really, really like, and gosh, she's escaping me right now. Her website is Downshiftology. Are you familiar with her?
No, I haven't. To look her up.
Gosh, she's great. She has some great videos on meal prep, like maybe seasonal meal prep for the week. It's all about planning ahead. Like I said before, it's simple. It's not easy. It's simple, but just not easy. And the planning ahead does wonders. Also simple, but not easy. It takes time and foresight, but when you do that for the week, it does make it a lot easier. And I'm not perfect. My family's not perfect. We certainly eat ultra processed food from time to time because we're busy. But we try to limit that as much as possible. And I think another thing just to be kind of cognizant about, just to keep in mind, is that you can't beat yourself up for it either. Because that's not helpful. That's not helpful. You just have to say, okay, well, this is how it is today, and tomorrow I'm going to do the best I can. I'm going to do better and move on. But every day that you can kind of have something a little more ideal, the better.
And have you seen any correlation from like something like intermittent fasting and heart health? Has there been any, studies or relationship between limiting yourself at least a few hours a day, 12 to 16 hours, they say?
Yeah, I haven't seen any in the cardiology journals, but I do know that it works. I mean, I know that it works, like I said, for, well, I didn't actually say that, but a lot of people who do keto also do intermittent fasting, and it certainly goes a long way toward weight control and, having a lean muscle mass, just having a lean body. I know a lot of people find that it helps with brain fog too.
Okay. Yeah, that's good. And any word on like a vegan or plant-based diet versus that in relation to the heart? There's always controversy around that diet, so I was just curious from a cardiologist point of view.
Right. So I really haven't decided where I fall in terms of the whole keto. Certainly, I think intermittent fasting is good. And I think low or minimal carbs is good, but I haven't decided where I fall on the whole keto, vegan, vegetarian spectrum. You can eat unhealthy on a vegan or vegetarian diet. Just because a diet is vegan or vegetarian doesn't mean that it is healthy. It depends on what you're eating in that diet. And so as long as you're finding good sources of protein and iron, I think that you can have a very healthy vegan or vegetarian diet. But I think that some people are just misled, and they think, oh, I'm going to lose weight, or I'm going to be healthy just eating vegan or vegetarian. And that's not always the case. It's actually pescetarians who live the longest. Oh. Did you know that?
No, I didn't actually.
So pescetarians are a group of people who eat mainly plant-based diet, but they also have fish and I believe shellfish in their diet as well.
And I can imagine the more they eat that's not farm raised, probably even the better.
Yeah.
Or ocean caught or wild caught. Yeah. But
I haven't seen any studies about that, but I would suspect that's the case. I think you just have to be careful about the amount of mercury that you're eating if you're eating the larger fish. And the larger, deeper fish tend to have the better oils in them. So it's kind of a trade-off there.
Yeah. And then also we always hear diet and exercise. So exercise is obviously a great way to help us. What are some common recommendations in terms of exercise for your heart?
So the American Heart Association recommends 150 minutes of moderate intensity exercise per week for most adults. And that means that you should be, you should have your heart rate up a little bit. You shouldn't be struggling to speak as you walk or run, but you should feel it a little bit. And I think a lot of people struggle to get that. And it doesn't really matter how you get it. just as long as you get it. And so if you want to do an hour on Tuesday and an hour on Thursday and 30 minutes on Saturday, or 30 minutes Monday through Friday, that all counts. And whether it's mowing the grass with a push lawnmower or doing yoga or walking or running, all of that adds up. And the important thing is to do what you love so that you'll do more of it, or at least just do something that you enjoy and incorporate that. And they don't go so far, but I like to recommend that people incorporate different things. So some strength training, flexibility is incredibly important as people get older, to maintain mobility and maintain independence. I see that a lot with my older folks. So some strength training, balance, flexibility, some cardio, and that, doesn't have to be a full out run. It can be just walking or biking, but certainly moderate intensity, better than just light if you can tolerate it. And if you're not doing that right now, maybe you just start with a few minutes a day and work your way up, and increase every week or two until you get to your target.
That's great. And when you start to do something like that and you feel stronger and more flexible, it's a little bit of a motivating factor too, and you feel better.
Absolutely. And so exercise goes so far towards, abs are made in the kitchen, not in the gym, right? So unless you're starting like a boot camp program, you're probably not going to lose a lot of weight by exercising. That's going to need to be done in the kitchen, but it certainly helps you maintain a healthy weight. It'll help you get past a weight loss plateau if you're there. It improves the quality of your sleep later that evening. It reduces your risk of heart attack and stroke. It reduces your blood sugar, so it reduces your risk of developing diabetes. It goes to reducing, I don't know if I said your blood pressure, I think I just did. Just so many different things that exercise is good for, reducing or delaying the onset of dementia.
Wow, that's incredible.
Yep.
Is there anyone who, let's say they've been diagnosed with some type of heart disease? Some people start in like a cardiac rehab and go that route to make sure they're monitored. But someone who's starting out, maybe they haven't been diagnosed with anything, what do you have them watch for if, like, let's say there's a family history of heart disease? Is there any like signs or symptoms that you might have them say, okay, as you're starting to exercise, watch for these, and this may mean you're pushing it too much or you need some help?
Sure. So if you are a total couch potato and want to start an exercise program, that is awesome. If you haven't been to your doctor in a while, just go ahead and go and talk about those risk factors and get your blood pressure checked. If you do some exercise and you feel good about starting on a program without getting checked out first, I would just say start off slowly and gradually and increase the intensity and duration over time. But be on the lookout. If you haven't been exercising, certainly you might experience a little bit of shortness of breath and you might get tired pretty easily. And so you just kind of have to gauge whether or not you think that's within what's to be expected for your existing level of fitness. But if you're exercising and you can't, you feel really short of breath, you get really tired, you have to stop and rest very often, you have any chest discomfort. And when I say chest discomfort, it can be anything from like almost the level of the ear to the belly button. So when people come to me and sometimes I'll say, well, it's not a pain, it's a tightness. And I'm like, yeah, no, I promise you, I'm hearing you. My brain is trained to hear pain when you say tightness, because that to me is the same. So it can be any kind of chest discomfort, but jaw discomfort, neck discomfort, shoulder, especially if it's in the chest and it radiates to one shoulder. It doesn't have to radiate to the left shoulder, it can radiate to the right shoulder, can radiate down both arms, it can radiate to the back. It's pretty common if you start exercising to get a little short of breath, and that goes away when you stop and rest, and maybe it'll start back up if you start exercising again. But if you feel at all that it is out of proportion to the work that you're doing, or it's just not getting better, then it's time to go see someone.
Right. And sometimes I know my dad had angina and he would do some stuff on the treadmill, feel the pain, would try lifting weights, wouldn't feel the pain. And I was on him for a couple months and he went to see several different doctors. No one diagnosed it. And finally, he eventually saw another cardiologist who sent him for emergency surgery, 95% blockage. So very, very aware that it's good to listen to your body.
My father-in-law had a similar experience. He had his first heart attack at the age of 40, long before I met him. And a lot of that was lifestyle. He smoked, and I don't think that he ate well at that time. And after that, he quit smoking. He started exercising. He did great for about the next 20 years. And he told me that he had a little bit of chest discomfort when he ran really hard. And I said, okay, go see your doctor. They did a stress test on him. It was negative. And a couple of months later, he's like, still having it. I was like, yeah, you got to go back. So what can happen sometimes with people who are athletic or is that they sort of precondition their heart. They can tolerate a lot more than someone else would be able to. But if it's persistent, and you hadn't had that before, you really have to go back and get it checked out, because those stress tests are great. But the best ones are accurate only about 96% of the time.
Okay.
So they're not 100%. You have to listen to your body and just pay good attention there and know when to seek help. And if you're not sure, just seek help, go ask. And it's always better to catch those things early on than later. And much like your dad, my father-in-law ended up with a bypass surgery and did really well for the next 20 years.
Yeah, that's good. And very grateful for the ability to have these procedures, but obviously I'd like to try to push them off or not have them if possible.
Yes.
So
absolutely.
And so when we're talking about kind of heart disease and even the coronary artery disease, how much does cholesterol play a role in terms of, I've heard stuff out there that when you get your cholesterol checked, that gives you an indication, but it's not everything. More like the C-reactive protein might be a better measurement. I'm curious, what is the latest in terms of looking at cholesterol or C-reactive protein?
So the high sensitivity CRP will give you an idea of the inflammation there. The cholesterol numbers, we don't, it depends on which medical specialty college you follow. So I like to follow the American College of Cardiology recommendations, and their current recommendations are based on risk. So how we treat cholesterol these days is based on risk. So diabetes is considered a heart disease equivalent. So if you have known heart disease or you have diabetes, then your target cholesterol numbers are going to be way lower than the average population. And then for everybody else over, say, between the ages of about 40 and 80, we calculate something called an ASCVD score, and that's based on age and the presence of all kinds of other comorbidities like high blood pressure and what your blood pressure is and then we decide what your target cholesterol would be based on that. So a lot of high cholesterol is genetic, but some is definitely from diet. And going back to, we talked about diet before, and I hesitate to recommend a keto diet to anyone, a vegetarian diet to anyone. One thing that I really like is the Mediterranean diet, and it's been named the #1 diet several years in a row. And I think that you can modify that diet. I mean, you don't have to eat Kalamata olives and olive oil necessarily, but it's a great diet, and you can modify it for keto, and you can modify it for if you're vegan or vegetarian for different reasons. You can follow it if you're gluten sensitive. So that is a great diet to look at for reducing cholesterol naturally, but also exercising, and maybe some fish oil, and the rest of it's genetic, and you just might not be able to get past that.
Right. And then something else that is in my world a lot is people having stress. I'm always working with people to help with stress, anxiety, and chronic pain. But how much do you see stress playing a role in heart disease? And I know that can be a little bit hard to quantify and qualify to for a study, but I'm just curious what you see out there.
Right. You're right about the how do you put a number on that,
Yeah.
Um, yeah, stress is definitely a big contributor to heart disease, and probably through several different mechanisms. One is that it causes chronic stress causes our body to release chronic levels of our fight or flight hormones, which create inflammation in the body, which is something that I know that you have a particular interest in. That chronic stress is not good for us. Those hormones were designed to help us run away from the saber-toothed tiger or something. They weren't. Those hormones weren't meant to be around 24/7 like they are for us today, are constantly on society, and they contribute to inflammation in the blood vessels and other places. It also impacts our quality of sleep, which we've already talked about is really important. um, the body repairs itself at night when you sleep, and you need that rest. That rest is very important. um, Stress will increase your blood pressure. um, so a lot of different mechanisms for stress to affect the body and affect the heart. And we know that people who are stressed are more likely to have a heart attack.
Mhm.
And just saying reduce your stress is not, it's a very difficult thing for the average person to do. And you know how important the work that you do for helping to reduce that stress is. We also know that in severe cases of stress, um, it can cause unstable plaque, so plaque rupture in the arteries of the heart, but it can also cause a specific type of heart failure, a stress-induced cardiomyopathy called Takotsubo cardiomyopathy, where the patient might have pain and EKG changes and for all the world look like they're having a heart attack, but when we go in and do an angiogram, those arteries are okay, but the heart muscle has suddenly gotten very weak, and it's typically a certain pattern that we see on the imaging studies. And most people recover from that, but some people can have what we call cardiogenic shock, or shock due to that sudden onset of heart failure, and end up really sick, or even die from it. But most cases are reversible.
Mhm.
So that's good news. And, you would be surprised. I had a lady many years ago who I saw in the hospital with a stress induced cardiomyopathy. And we were, most people can tell you, my dad died. This financial thing happened, something else. But this lady, like, we talked and talked and talked about it. And she rear ended someone and felt so bad about causing the accident
Oh,
that for her, that was so much stress. So, even though that was not a life altering event,
mhm.
that was her reaction to
Yeah.
what happened. And so each one of us will internalize that differently, and it'll affect us differently. And what might seem really important for one person is not so important for another. But that stress certainly did it. Her heart was very weak. She did recover.
Wow. Yeah, we talk about so often we hear emotions and how we react to things are critical, but I mean, that takes it to a whole nother level where your emotions can really affect your heart like that. That's good information to know and for people to think about when they're reacting to their circumstances.
Right. Right. And
Yeah.
so, if you have a really bad piece of news that you hear and it causes you to have chest pain, don't ignore that. That's not just, you know, feeling sad or anxious. That could really be something serious.
It's incredible. So, as we go through the years, obviously technology changes and our knowledge about the body changes. Has there been some major shifts in how we think of heart health and heart disease prevention, I'd say in the past several decades to right now?
Yeah, I mean, we've seen so many advances in terms of how we detect and treat heart disease.
Mhm.
One of my favorite tests to do on one of my favorite types of patient, I call them the worried well. These are the people who show up in my office and say, my friend's brother died suddenly of a heart attack at the age of 55, and I just want to be checked out and make sure I'm okay, or, or some other similar story. And they are, they don't have any risk factors necessarily, or sometimes they do, and usually they don't have any symptoms, but they really want to know what is my risk. And there's a simple test that we can do called a coronary calcium scan. And what that checks for is calcium within the arteries of the heart. Calcium doesn't belong there. That is basically plaque over time, maybe 6 to 12 weeks that starts to get calcified. And so the more calcium you have there, the better. Now that doesn't look at a lot of the things that we talked about, like the valves and how well the heart muscle squeezes and that sort of thing. But that's mostly what people are concerned about when they come in. So there are a lot of things that we can do to detect tiny amounts of coronary calcium before it is ever clinically significant, and we can then counsel that person about how to prevent the progression of heart disease. And I think that advances like that are amazing. And we have certain things like VADs, which are ventricular assist devices. Certainly some of the new medications that have come out have been amazing. One thing I will say though is that and we've done a much better job of preventing or decreasing mortality from heart disease as well. One thing that we need to do a better job of is making sure that women understand their risk, because women are more likely to ignore their symptoms, attribute them to something else. They're less likely to seek medical care for their symptoms. And even when they do, their provider, their doctor, their nurse practitioner, or whomever is more likely to discount those symptoms as well. And that's a bias that we need to address and change. It's better, but it's not quite where you would think that we should be today based on what we know about heart disease. And it's really important for all of us to keep in mind, both the patient and the doctor, so that we don't discount that. And we've also recognized too that we might take that same patient and we might do an angiogram, and we might not find blockages in the arteries of their heart on that angiogram, but that doesn't mean that they don't have what we call microvascular dysfunction. So they, in the past we would tell them, oh no, we took a look at everything's fine, there's nothing wrong with you that we can see. But these days we know that maybe it's the tiny vessels that we can't see with our angiograms, but there still might be something there that needs to be treated and paid attention to.
And so if someone has a problem with these little tiny vessels, would that show up overtly as a sign or a symptom or a discomfort, or could a person just go through life and have this problem but not even know it?
I suppose they could, but typically they'll have the symptoms of angina. So they might have some chest discomfort, whether that's pain, pressure, or tightness. They might have what we call anginal equivalents, which is like the jaw pain, shoulder pain, back pain, or shortness of breath on exertion, or just exercise intolerance. Like, I don't know, I used to be able to run 3 miles, but I can't anymore. And I don't know what caused that. And it's, just getting worse. So they'll typically have symptoms of angina, but not know what to attribute them to sometimes.
And something like this, could it be reversed with diet and exercise and lifestyle changes when you have these issues with the microvessels?
I don't think we have any good data showing that it can be reversed with that. There's, a lot of good reason to use diet and exercise to prevent it from getting any worse. and just in general.
Oh, that makes sense. I mean, why not improve your health by
Right.
doing all these things anyways? And
Right.
the other thing is it hard to get people to change? I mean, is there any strategies that you use to motivate them?
Yeah, it is. It is really hard to get them to quit for my smokers, because that is one of the biggest things that you can do if you smoke. Quitting is one of the most dramatic things that you can do to decrease your risk going forward. Just really counseling them about how much those tobacco companies are stealing from their pocketbooks and their lives. I mean, literally stealing their breath away. It's the usual counseling of like, how are you now? How would you like to be in the future? How trying to get somebody to come to that realization on their own of what they need to do, and maybe trying to help them plan, eating out less, planning meals ahead of time, prepping those meals ahead of time. It, it, it's kind of like kids. You can't give them the motivation. It has to come within, but you can usually question them and help to lead them there. And sometimes you can get them just plain mad at those tobacco companies. I mean, I can't believe we allow them to do that.
Yeah.
There was a tremendous lawsuit years ago. A lot of the southern states sued some of the major tobacco companies because they intentionally got people addicted to cigarettes, knowing the health risks that were involved, and they lost that lawsuit. And so there's money there. It is called the Smoking Cessation Trust, and there's money there to help people quit smoking. So smoking cessation clinic visits, counseling either in person or over the phone. In the past, they helped pay for Chantix prescriptions, which has been helpful for a lot of people in quitting smoking. Not everyone tolerates that medication, and I don't think it's available right now, but it has been helpful in helping many people quit smoking. But also nicotine patches or gum, that sort of thing. So smoking cessation aids.
Those are good things. And I know exercise has to be from within. No one can get anyone to start moving differently, but I think talking to people about how much better you feel, and just if you can gleam on to how good you feel after you exercise, that can be a great motivating factor.
Yes. So I love exercise. I make sure I ask almost every patient at every visit, what are you doing for exercise? What can you do for exercise? And sometimes it's something that we take for granted, because if you develop back problems or certain orthopedic problems, it becomes difficult to exercise, and then people really know how much they miss it once they can't do it. And like I said, it's so important in keeping your blood sugar, your blood pressure, your cholesterol all under control, reducing the risk of diabetes and high blood pressure, and getting good sleep. I love the studies the information that show that it reduces the risk of dementia, or delays the onset of dementia. I'm looking forward to that one. My one of my 10-year goals is to be in the best shape of my life as I approach 60.
So you don't look it. And I hope is a marathon on that list, or do you stay away from that?
Well, I've done a few halves. I've not done a whole marathon. I don't know, maybe you and I can talk, and you can get me in the mindset for the whole. I'm not opposed to it. I would love to be able to do it. But I haven't yet.
Okay.
I haven't yet.
We can work on you.
Let's work on it. I would, even if I had to walk it, even if it took me 8 hours.
You can do it. You could walk it in probably 6.5.
Okay.
Definitely do that. I'll even go with you. Don't worry.
Let's do it.
Awesome. Well, wonderful. So really appreciate your time. If people want to reach out to you or find other resources, what would you recommend for that?
So I am on Facebook and LinkedIn, and you can find me on Instagram under my first name, which is Jherie.
Mhm.
And for resources that you can really trust, I would say the American Heart Association website has some great resources for the general public, including recipes and recommendations for exercise
Wonderful.
and general information about different heart problems.
Okay. Okay. Well, thank you so much for taking time off your Saturday, your day off to join us today. Really appreciate it. And I know you've provided helpful information to our listeners.
Thank you for having me.
Yes, thank
Glad
you.
to be
And
here.
wonderful. And thank you all for joining us this weekend. We're taking next weekend off. I will actually be in Iceland on a vacation that's much needed to celebrate my birthday as well. But thank you guys all for joining us, and we'll see you again in 2 weeks right after Thanksgiving. Have a great weekend. Bye now.